my audience, my informative speech. Thanks for coming so I could tell you guys all about premature babies and the difficult road that they face afterwards. From my personal experience, my youngest son was born 10 weeks early and spent the following 8.5 weeks in the NICU. During that time, he went from a ventilator to CPAP to regular oxygen mask. Then he still went home on oxygen for another 2 months. Every day, millions of babies are born prematurely. In the U.S. alone, 500,000 babies are born prematurely each year. That's 1 in 8 babies. It's not just when they're born, though, that the effects are gone. The effects last long after birth. CDC defines premature birth as anything before 37 gestational weeks. People who are at increased risk of having a premature birth are African American women, people who have had previous premature babies, girls who are younger than 18 or over 35, if you're underweight or overweight, even if you have medical conditions such as hypertension and diabetes. Once the baby is born, they're put in the NICU, which is a neonatal intensive care unit. They're put in an incubator, which helps them maintain their body temperature, since they're not able to do it themselves. If they're not able to breathe on their own, they're placed on the ventilator, which does the breathing for them. And then after, they're moved to a CPAP, which gently inflates the lungs and helps them breathe a little easier. And then they'll be moved to an oxygen mask or the nasal cannula, which just provides a little extra oxygen. If they're not ready to eat on their own, there's a feeding tube placed in their either nose or their mouth and goes straight to their stomach, and that gives them the food. Often an IV will be placed for extra nutrients and extra kilocalories. Many babies who are born prematurely suffer a brain bleed, known as an interventricular hemorrhage. These go from anywhere from a grade 1 to a grade 4. Grade 1 or 2 is slight bleeding, nothing serious, and usually no long-term effects. Grade 3 or 4 is a lot worse and can actually cause swelling of the brain and developmental delays. Of course, the worse it is, then the worse the chance of having long-term effects are. Signs of a possible brain bleed include apnea, or breathing pauses, changes in the blood pressure or heart rate, decreased muscle tone and reflexes, excessive sleeping, lethargy, and also usually seizures and a weak suck. How well the baby does and heals often depends on if they have a brain bleed and how bad it is. Up to 1 in 5 babies who have a brain bleed are subject to death. Oh my goodness. Aside from the feeding, other possible health problems include heart defects. 2 common ones are the PDA, which is an opening that usually closes shortly after birth, but with premature babies doesn't always close. It's usually closed by medicine, and if the medicine doesn't work, then they'll do a surgery and cauterize it. Another one is the patent-forum ovale, which is a small flap-like opening between 2 of the chambers that usually closes after birth, but with preemies doesn't always. According to Dr. Grady, who's a cardiologist at St. Louis, he said that 1 in 5 adults are walking around right now with a PFO and have no idea. Another increased risk with premature babies is cerebral palsy. Nearly half of all babies who have cerebral palsy were born prematurely. The lower the birth weight of the baby increases the risk of having cerebral palsy. Another one is respiratory distress syndrome, which is difficult breathing. And that's usually caused from a lack of surfactant on the lining of the lungs, which an artificial surfactant is usually given to the babies, which helps them be more slimy and less sticky so that the lungs don't stick together and collapse. Problems with the respiratory distress syndrome are difficulty breathing, and that's usually when they're placed on the oxygen, which can cause them to, if they get too much oxygen, that can cause brain issues. Worst of all is death. Of the 1 million premature babies born around the world each year, die out of the 15 million that are born, according to the World Health Organization. And after the NICU, things don't often get better. There are countless doctor visits that you have to go to. There's an increased risk of SIDS for the babies. And then depending on the health, they often have to go home with oxygen on an apnea monitor and have a lot of medicines that they have to go through. Although babies are born prematurely, sadly the effects don't end there. They do go home with the parents, and that's hard on the babies and the parents. Am I done?